Hello, everyone. Hello, everyone. I'm Itzel Chavez. I use she, her, hers, or they, theirs pronouns. I work on the development team at Centro Cultural. I'm so excited that everyone is here with us today. And let me start by acknowledging the land and the stewards of the land that make our work possible. Our work is very grounded in community, and that community exists on the stolen land that is now known as Portland Metro. And we have so many reasons to be thankful for the tribal bands of the Kalapuya, the Molala, the Chinook, the Tillamook, Yamhill, Clackamas, Multnomah, and so many others who have really cared for this land since time immemorial and who are currently living through a genocide which began 3 generations ago. They continue to carry on their practices and their ancestral knowledge, and we thank them. And on a similar note, we also want to acknowledge the relationship of cultivation that migrant farm workers have with this land and the generations that will come to inherit the land. So with the spirit of gratitude, allow me to proceed with our topic of today, which is health equity. So we want people to be excited about it. We want to talk about what it's meant through, what it's meant, health equity has meant through the pandemic, and what can still be changed through the different sectors of our economy and how kind of we all fit into that. So please, in the chat, introduce yourselves, you change makers in the comments, your names, your pronouns, where you're calling in from. And if you would like to know the ancestral name of the land, you can go to native.ca in your browser. It's native.ca. And you can type in your city or whatever, what it's known as now, and it'll tell you the ancestral name. So while you're doing that, I will thank the event sponsor, First Tech Credit Union. They have been huge supporters of Centro, and we're really excited about the spaces of equity that we'll be able to lean into with them. And we also want to thank Pacific University for supporting the webinar style event. So thank you for Second Pacific. And it's important to shout you all out because of the energy, the resources that you're doing to make this event possible. So this is a Giving Tuesday event, and there are incentives. There's free wine tastings available, Columbia store passes if you give at certain levels. And you also, if you donate before tomorrow, you'll be able to get into a raffle to receive a hotel stay in Eastern Oregon. And so we'll have the link in the chat right now pretty soon. So you'll be able to donate to that, and the proceeds will go to economic and health justice programs at Centro, and they're all appreciated greatly. Some of you have already given, and I want to say thank you so much for that. And thank you so much for letting me introduce this event. And I want to introduce next a very special guest, Octaviano Marecias, who is a doctoral student at Johns Hopkins University. And he is a manager for organizational training and education for diversity, equity, and inclusion at OHSU. So today he's wearing a different hat, and he's joining us as a community member with a spoken word piece. So Octaviano, thank you so much for being here with us today.
Muchas gracias. Thank you very much. Kutaushani, cha'a, nya'a, cha'luli, nya'aluli, cha'hasquatutu, nya'hasquatana. The piece for today is titled Health, Healing, and Wellness. Spoken words, poetry for la gente. During the welcoming hands of a healthcare worker, we find the abuelita wisdom with one hand opening the door of the center of this community, and with another handing you a pamphlet with info, like grandmas handing over medicine in the forms of pages, ink, sage, copal, thoughts, prayer, reminding us in the absence of hugs, we become smiles. In the absence of hand-holding gatherings, we are songs in paucity. And in the presence of pandemics, we have each other as medicine in community. Medicine. When our words become vitamins, our memories reach out to roots of ideas, turning into tranquility, like vaccinating transfusion of hope into healing thoughts, becoming inner medicine. like weaving time and kindness in this waterfall forward, showering us into becoming the thought of our ancestors, like the trail of time imprinted in canyons, aligning ancient layers of tattoos into our wisdom, into wellness. By the simplicity of kindness, by complex mystery of galaxies vibrating within each cell, because our thoughts are lights oscillating between the darkness of health inequities and the gasping necessity for access. So we move from fuerza to fortaleza, from silence in absence of hugs to resiliency, resilencing the fear of pandemic. If the informal curriculum now it's our humanity in love, then the formal curriculum of humanity it's community care, health care. In the presence of statistics, we have a book in each life and individual songs in each narrative between patient and provider. If the intervene of our humanity through systemic connection is access, then humanization of systems into vibrating connections is caring for health care, where our collective mental models become inviting systemic webs of healing, interweaving each string of our systems, where points of connections become story sharing rather than numbers. This too is our comunidad's journey, a curation of library, because each life touches many pages of each other's chapters, and each sentence we write is made of thoughts plasmados into ink, fabric, words, palabras, collective pages resonating as pulsation of heartbeats throughout the ages. Because in the absence of hugs, gatherings, we have each other thoughts, today presenting, gifting in circle. Thank you. Gracias. Kutaushani.
Octaviano, thank you so much for sharing that piece with us today. We're so grateful that you were able to be here with us. So thank you so much. And with that, please share emojis in the chat. Please share your thoughts, who you are. Remember to put your names, pronouns in the chat and where you're calling in from. So thank you so much. And with that, I'll hand it off to Felicita Monteblanco, our moderator for this noon hour panel. So Felicita, thank you so much. She's the Public Affairs Manager at Northwest Health Foundation. We're so excited to have you here today. Thank you, Felicita.
Thank you for having me. Good afternoon, everyone. My name is Felicita Monteblanco. I use she, her pronouns. Thank you, Itzel, for the introduction. More than anything, I'm a longtime friend and supporter of Centro. I love the staff. I love the work. So happy to be here today. I want to quickly introduce our wonderful panelists so that we have plenty of time to hear from them. So we have Vanessa Guevara, Community Health and Wellness Director at Centro. We have Izzy Ventura Meda, Executive Director of Familias en Acción, and we have Olivia Quiroz, Executive Director of the Oregon Latino Health Coalition. And we're going to learn so much from these folks today, so we're going to jump right in if that's all right. Feel free to use emojis when you hear something that you like. We hope to have some time for Q&A at the end, so feel free to put questions in the chat, and I know Itzel will be on top of it. So first question. As nonprofits seeking support for your work, you often have to make the case as to the importance of health equity. How do you conceptualize and explain the value of health equity to donors, partner agencies, and those you serve? Vanessa, I'll kick it off to you.
Thank you so much for those introductions. And as far as the question itself, with our generous donors, including partners, and also those that are giving to Give Guide, we love to re-emphasize the importance of health equity by defining it, reaching out to equitable health delivery and services for all, despite race, ethnicity, class, and gender. So that is definitely a reminder that we give a lot of our donors, including yourselves. This also to make sure that everyone has the right to reach their optimal health and reach their absolute potential, regardless of such demographics. And not to mention, this COVID-19 pandemic has also given us the opportunity of reinvesting into our data. And in doing so, we also use tracking methodologies and highlighting those discrepancies within our demographics. And those also serve as hard evidence and reminders to back that definition up. So yeah.
Thanks, Vanessa. That's great. Thank you for bringing up data. Izzy, I'll hand it to you.
Thanks, Felicita. Actually, I think this is sort of kind of a question that sort of kind of is very emotional for me. I think Vanessa, you sort of kind of hit the nail on the head, as they say, using the word redefining. I think that over the pandemic, I saw and witnessed firsthand what it really takes to make the case for health equity for Latinos here in Oregon, specifically again during the pandemic. As nonprofit organizations and as leaders in this community, we were in a way forced to go on a parade that forced us to demonstrate all the harm that our community has suffered throughout many years prior, and then all of the harm that has been happening during that pandemic. And it sort of kind of felt like the only way that we could get groups or institutions with resources, with ability to respond, to really and actually respond, was for us as leaders to go into these groups and just sort of kind of demonstrate again all of the harm in our community. It was really tragic. It made me really angry that I had to do this over and over and over. And it was with one group, and then they're like, oh no, you're talking about this with the wrong group, go to that group. And there I had to go. And again, just this whole like roadshow of the devastation. And so I think, Vanessa, you hit it where I feel that we really need to redefine how we are in a way forced to conceptualize health equity that is away from demonstrating harm and maybe more towards leveraging all of the strength that our community already has. But currently, I just feel like, you know, even as of last year, that the only way that health equity was really a focus area for a lot of the groups or institutions in charge was really, again, demonstrating how much harm our community has gone through. And I don't like that. And I don't want to be put in that situation again. I don't think anybody should. I just think we need to redefine and refocus that.
Thank you, Izzy, so much. I think I'm going to remember for a while Roadshow of Devastation. I think that's spot on. The emotional toll all of this has taken on our leaders isn't talked about enough. So thank you. Olivia, anything you'd like to add?
No, I mean, I think that I was lucky enough to join Izzy in those roadshows and have him as another leader in our comunidad. And so I shared the same sentiment. It's traumatizing, but I think in the larger scope of work, public health in America is in a crisis. And this goes back of decades of this underfunding and the failure to invest in our public health workforce, in health prevention programs and systems that have left the Latino community behind and more vulnerable to the crisis that we're dealing with right now, like the pandemic of COVID-19. And so I think that that is an area where, as community-based organizations, we do in this new reimagining phase is also for funders to create new initiatives, new ways that are more long-term sustainability, grounded in racial health equity, and also flexible for us as community-based organizations to implement these programs on the ground.
Well, I think our attendees are realizing what an amazing group of panelists we have here. So thank you. Everything so far has been fantastic. I appreciate the thoughtfulness that everyone's bringing to this. So next question. We saw that chronic illness exacerbated the impact of COVID-19. So it's also critical that we address those. What preventative measures for chronic illness are difficult to address? Izzy, want to take this one first?
Sure. I think this sort of kind of piggybacks to my answer with your previous question. Over COVID-19, I think we saw that some of the most difficult things to address are some of the most difficult things to have to conceptualize for others who may not be experiencing some of this, some of these impacts at the disproportionate rate that a lot of our communities are, right? So things like structural and systemic racism, I think, are preventative measures that, create and cause chronic illness that I feel are very hard and difficult to address, right? Like that's been something that has been highlighted over the last year and a half, that has been really hard for a lot of communities, again, on this roadshow, to have to explain racism and how that's impacting my housing, how that's impacting food insecurity, how that's causing chronic stress for a lot of our communities. And then you go into and analyze that a little further, and you think about the impact that something like chronic stress might have on the Latino community. Here at Familias, we have within our food equity program, we focus a lot on epigenetics, right? And we think about chronic stress that mothers go through and how that's really transmitted into their babies. And we continue to create unhealthy generations over and over and over. And a lot of that, again, has to do with all the systemic inequities that our health system, and not even our health system, but a lot of the systems that we've created in this country are, like I said, housing, for example, it is causing a lot of chronic diseases, or perpetuating them or exasperating them or making them more chronic. So I do think that structural and systemic racism is something that we need to continue sort of kind of fighting against. But I really do think that is one of those that has proven to be very difficult to figure out how exactly to bring this topic and this issue forward as a preventative measure, perhaps. And then I think also addressing the disproportionate health impact of climate change in our community is going to be something really hard for us to address. Like COVID-19, climate change is going to add a layer, or is adding a layer of cumulative impacts that are exacerbating already existing disparities. And so really trying to focus on the health impacts of climate change is really something that I look forward to, but also anticipate difficulties in trying to sort of kind of address that.
Well, I'm just fangirling over you, Izzy. I mean, epigenetics and talking about racial equity, this is all wonderful. Thank you. And that both Olivia and Izzy have talked about how preventative these things are. So that's why we're here today, to talk about these issues and talk about things that we shouldn't have to talk about, but here we are. I think Vanessa or Olivia, anything to add?
I just want to applaud for definitely the social structures that have enabled racial inequity. Not to mention, I would like to highlight also the ambiguous topic of assimilation, especially from first-generation immigrants and families. We are here with our own family and ideals and value systems, and coming into America's societal expectations of success, of having to have wealth and having that classism that exists socioeconomically. We have less opportunities to be able to achieve. And not only us as Latinos, but there's also minority groups and populations that are also have been abandoned within this as well. But we're all forced to abide to this one societal success. And the thing is, at the end of the day, the pandemic has highlighted the importance of family, the importance of our time, the importance of our health. And those are things that, culturally speaking, I think has resulted in chronic illnesses as a family, a Latino family with a father that works 2 jobs, or maybe a single mom with her 4 kids and having to alone have an extended family and care for her other family members. These are all very important values specific to not only Latinos, but also other cultural populations. But these are really important values that shouldn't be abandoned, nor should we make exceptions because society is telling us that we have to have that wealth, that we should have small families, that we do not have that privilege of having that generational wealth to meet demands. And I think the beauty about the pandemic is the fact that we're able to refocus on that and be able to see how we are short-handing a lot of our populations there. And we should still value our family dynamics and value systems.
I love that. Thank you, Vanessa, and thank you for the reminder of the critical nature of Centro's work. Olivia, go ahead.
I mean, I think that I love how Octavio started this panel with bringing our indigenous and cultural roots to the forefront. And I think that and adding to the comments that my colleagues had mentioned, I think that, we can, if we can continue on that path, that our community, for some of us, or like myself, my family that migrated here when I was younger, we did come healthier. We came with better ways of eating healthier foods, of cooking our foods, of coming from a communal community where we sit down and enjoy dinners, to walk and bike. So all of those things that we practice, that, to continue to do those things as family, as individuals, and check in on each other. These are hard times. And so to pick up a habit that we might have lost to the pandemic is pretty difficult. And so I think that the more we use, what we have in our cultura and check on our vecina, those are the ways that I think that together we can continue to, become a healthier community and organizing among ourselves as well.
Thank you, Olivia. I wish we could all be together and I could snap. Every time I heard something that was fantastic, I'd be snapping the whole time. Next question. The economic impacts of the pandemic were felt across the country, and we are still trying to recover as COVID remains pervasive in the community. Our economic systems weren't prepared to handle the impact. According to a survey led by Unidos US, the Latino community is seeing its highest unemployment rate, 20%, since the Great Depression. Can you speak to the impact that prioritizing health equity can make on economic resiliency and prosperity? Vanessa, let's start with you. What are you seeing at Centro?
Well, as far as Centro, I know that we're heavily prioritizing investing in our staff by having competitive wages and benefit packages, including health insurance, so then we don't have to navigate through the health system, which is also a disparity within itself, but we understand that and provide those services. As far as responding to how economically speaking we can make that impact less so, or why it has become an impact of unemployment, specifically with Latino population, I would say that it comes from 2 different sectors. Either from a humanistic standpoint, I think people are valuing their mortality, and that has definitely highlighted within the pandemic. And I think we're starting to use self-preservation and knowing that, yes, cardiovascular disease does run with men generally, but we also see a disparity within Latino men and our white counterparts and other minority men as well. But within that, there's also the economic standpoint that a lot of organizations and for-profit organizations have highlighted the importance of human capital, that we should be investing in our human beings, that we should be making sure that our employees are happy, because we will lose less money every year from training and turnaround. But using that in a humanistic form is become more and more highlighted even within our cultural community and even during this pandemic, because once people had to lose their jobs and think of other ways and be creative about it. And much like that was stated before in our written word, is that we might be left with, what was the terminology? I'm sorry, it was in the absence of hugs, we have smiles. So like, regardless of the certainty that the uncertainty of work, we are still going to have our family, and that has become a quality. And I think that again, it goes back to my last point, as far as persevering and finding creative ways to maintain our families, because that is our number one value.
Thank you, Vanessa. Olivia, thoughts on health equity and economic resiliency and prosperity?
Yeah, so that data point you share around our unemployment rate at 20%, I think that we can also disaggregate the data point, and it would probably demonstrate that women, mujeres, have the highest unemployment rate, because many of our mujeres had to quit their jobs. So they left the workforce, stay home, take care of the kids. Many kids are, doing online learning, and that is tripled the work for our mujeres. And then many of our mujeres, like the mujeres in my familia, like, my sister, my other colleague who's an executive director, working from home. So I saw firsthand what that toll that took on mujeres in our comunidad, both at the professional and at the unemployment level. And I think that for us at the Oregon Latino Health Coalition, we take a health in all policies approach. So we lobby, we advocate health policies that can move the dial from the economic standpoint to creating universal preschool for all. Childcare, as we know, Oregon is one of the highest, I believe, fees across the nation, and it's like on the top for very expensive childcare expenses and cost. And that takes a huge chunk out of our working families and out of single women in our community that are struggling. And so if we were to pass those type of national and statewide policies, our women in our workforce would be in a better position. The other one is health coverage for all. That's another big piece that also takes an impact, not just on the mothers, the adults, but on kids as well. And so those are still gaps in our community that is also part of the economic impact. And I think the pandemic also demonstrated what happens when we don't invest in a workforce, when we don't have better policies in place, restaurants shut down, people leave the workforce. It just, it impacts in so many multiple directions. So, I think that things at the national level with the Biden administration and the Build Back Better Act that is working its way through the House, those are things that I hope they pass and they start trickling down to the statewide level. But I know that Oregon is also leading some charges in Multnomah County, in other areas. And I hope that we continue to push for more of those equitable policies across the board.
Thank you, Olivia. All about policy. And I know we're going to talk a little bit more about that soon. And I appreciate you bringing up pre-K because there's exciting conversations happening in Washington County about that. Izzy, anything you'd like to add?
Maybe I can just piggyback a little bit on what Olivia was commenting. I guess I want to say that like the proof is in the pudding. COVID-19 has impacted the health of so many Latino Latinx folks that, if we're sick, we can't work. That's just how it is, right? And like Olivia was mentioning, I know there's numerous studies that have shown the link between like parental health and child health to both educational and like future economic self-sufficiency, where they've concluded that like the parent circumstances affect the child's health, and not only is child health important, but like that affects the child's future and prospects like in a lot of ways, right? So for example, I heard of stories during the pandemic where moms or parents had to leave their kid home alone because they had to go to work, right? And there having to be this need between the parent and their employer, where there was a situation where the mom was like asking their employers, like, I need to go back home because my child is home alone and I need to help them log in to their school, right? So not only are children being left home alone, they're missing out on a huge part of their education. And again, education and health I think are the two main factors that are going to define a lot of prosperity for our families.
Thank you, Izzy. Sorry. The next question is specifically for you, Olivia. You have mentioned a few solutions, which love that, very solution oriented. But what are a few of the problematic policies that are in place that are deepening the current disparities?
Yeah, thank you. I always go back to the larger social determinants of health. So I think problematic policies exist in our economic, in our education, immigration policies, like all of those are things that influence our health, where we live, where we work, where we play, our economic status. But one of the things I'd like to focus on is our lower insurance rates and the poor health outcomes. All of these are deeply systemic. So for example, the employment-based insurance policy that we have in the US is implicitly racist, in part due to the unequal access to education and also the employment discrimination. Latinos are concentrated in the service industry where employers do not offer health benefits. Nationally, only 41% of Latinos receive health benefits through their jobs compared to 66% of white people. And when government programs, that pass laws or legislation to close this gap, and Oregon has led the charge nationally with, I think, 8 states nationally to pass laws like Cover All Kids, which provided Medicaid coverage to immigrant children. And now the work that our organization led this session in 2021, the Oregon Latino Health Coalition, with the larger coalition of supporters and people like Centro and others that are here on the call, we led Cover All People to expand that. That doesn't necessarily translate also to people receive their health benefits at the end of the day. So we still have people in our immigrant community that will remain ineligible to receive health insurance. And when people do have these benefits, things like health language, medical biases that happens in those rooms, discriminatory policies, some racist policies that happened, are things that still prevent people from fully accessing those benefits, which leads to devastating consequences and translate to barriers in our community. So we now, during the pandemic, we had those stories where people don't have their provider where they can call and schedule appointments or ask questions about the vaccine. So a lot of things in the vaccine is also rooted in the access barriers that exist in our communities, or the language barriers. Because for many people, they get surprised, but it's not always guaranteed that you will have bilingual medical services and documents. Till this date, in this era, we're still dealing with that. We should be moving beyond that, right? That is something supposed to be standardized across our communities, but unfortunately is not. And when we saw in the pandemic, those are crucial, vital things that our community needs to be informed, to be able to access, to treat themselves, and also now with the pandemic, get the vaccine that's available to our community. And unfortunately, in the state of Oregon, Latinos, Latinx communities, we still have one of the lowest vaccination rates. And it's a combination of access, of barriers, and systemic policies, as well as just lack of information. It's going to take a while for our community to move along where we see rates compared to the white community here in the state and I think nationally.
Thank you, Olivia. I really appreciate you reminding us about Cover All People. I know that we have leadership like Representative Campos, and we also have, for the first time in Oregon's history, majority female House, which is really exciting, and I think reflective of some of the work that's happening there. Women are awesome. Izzy and Vanessa, so want to talk a little bit about the here and now, meeting folks where they are, schools, hospitals, clinics, and workplaces. Thank you, Olivia, for reminding us about the vaccine disparities. Vanessa and Izzy, how can we increase the awareness of equitable economic and social policies to advance and improve health equity? I'll go ahead and start with Izzy.
I think it has, as Olivia was pointing out, I think a lot of this has to do with policy, right? And I think that a way that we can sort of kind of increase this is increase civic engagement from our community. Not only do we need to increase civic engagement, but we need to have accessible, and I can't stress that enough, accessible like policy making involvement and participation. So, I've been at Assimilation Acción since 2018. Involvement in policy work for me was a little bit newer. This past year, I was involved with the Health Equity Task Force that was bringing writing and creating a House bill, but my goodness, that was tough. The amount of barriers that exist for a collection of incredibly smart individuals and people to put forth or to impact policymaking was, just excruciating. It was painful. It was hard. It was condescending when we're talking about making policies that impact our families and our communities from experience, and then getting feedback that we're perpetuating racism by focusing on certain things. It was just, it's been very difficult for me as an individual to engage in policymaking, because there's like barriers within barriers within barriers to participate, to be involved, and to bring community along. And it's not even just, a seat at the table necessarily. I feel like it needs to be a brand new table, or the table already exists over here with community, and you all need to come over here and listen to what they got to say, and maybe we'll make a spot for you all here. But I do think that there is a place for our community in policy making, but the way that policy happens now is not accessible. And so if we really, really want to make sure that policies that are positively impacting our community are being made, our community needs to be more involved in that. And currently it's very, very difficult.
100%, Izzy. The process of bill writing, of moving a bill in the state legislature, it is formal, is way too formal, very intimidating. It is not a welcoming space at all. I think you're spot on that. One of the things that I think is a positive takeaway from the COVID pandemic is that moving forward now, folks will have the opportunity to give testimony remotely, via Zoom to the state legislature. And while that certainly does not fix all of the concerns, I think it's a step in the right direction to ensure a little bit more accessibility.
Yeah, and you mentioned something that's a part of policymaking, which is testimonies, right? And that sort of kind of touches upon my comment at the very beginning, that even some of this policymaking process or ways of making policy that includes testimony, this testimony is really again a demonstration of harm, right? You have to go into this testimonies and tell stories about how you've been impacted negatively, right? And you put families on a pedestal and have them sort of kind of divulge all the harm that's been happening in order to get policymakers to sort of kind of pay attention and realize that maybe some of these things might be important for community. So even the policymaking process itself and some of the components that go into it are really infuriating and like re-traumatizing. It's like, okay, so you have an opportunity to testify, but like that is incredible emotional labor, re-traumatization, and really exploitation of people's like experience and situation, I feel.
I mean, how can it be surprising that not many people give testimony when it's that traumatizing and overwhelming and intimidating? I know we have a couple electeds on this call. I know we also have the folks that work with our policymakers. I would really encourage everyone to take to heart what they're hearing today about, I know it's easy to think, well, let's just make giving testimony more accessible, but how are our policymakers reaching out to the community? We have tables set up already. Are you coming to our tables? Why do we have to come to your formal space? So thank you, Izzy, for highlighting that. Vanessa, anything you'd like to add?
Just to echo on that, the testimony side, but also to create initiatives for people who represent our culture groups in policymaking tables. I would recommend not only that, but also to something that Olivia said about having those biases even in the medical facility. We do not see people that represent our cultures in those spaces, and there should be an initiative that starts that all over again. And I think that that's a good way of getting our community involved, of being able to see and say that we have a voice in that space. So that's all I was going to add to that.
Thank you, Vanessa. Next question. So 2022 is going to be here before we know it. There's short session. There's all sorts of things happening. What are the most pressing health-related issues that your organization is focused on for 2022? Olivia, we'll start with you.
Thank you. When you say 2022, my eyes popped out. I'm like, what? Yes, it's around the corner. So for us, we're focused on implementation of Cover All People. The legislature approved $100 million, but that's not enough to cover over 100,000 undocumented adults. So it expanded the law from birth to 65. And we know that when we were talking about earlier today about disparities in chronic illnesses that is impacting the Latinx community, we know that people are more sick, and they're probably more sick now with the pandemic because we have higher rates of infection rates. So we're really focused around implementation so that it doesn't just stop about passing major legislation. It's really how implementation on the ground, outreach, enrollment. We talked about language barriers. Those things are big systemic barriers that exist. I read on the chat right now, yes, the application to OHP is heavily burdensome. It takes an hour for one of my staff to support a client or multiple calls to gather documentation. That is a systemic issue, a system issue, operational thing that really needs to be improved to really ensure that our community are self-sufficient, and they remove those barriers to for them to apply on their own. So that's a big piece for us. The other one is the recovery around the pandemic. We want to know what the data is telling us. Where did the disparities increase for the Latinx community? Disaggregating that by gender, by age, so that we're able better shape our policies for the next session and seeing what those disparities will look like. And we know that mental health, it just took a toll on everybody, regardless of who you are. It did, but for communities that were mostly impacted, our elderly, our youth, we're going to be reconvening our Latino Emotional Health Collaborative, and we have a partnership with Multnomah County and a partnership with OHA and their leadership to just not look at the metropolitan area, but also at the statewide level. And there was a lot of legislation passed on behavioral health workforce. We sat on different committees as well. And we want to make sure that things are implemented and trickling down to our BIPOC communities so that they're well funded, and also funding that trickles down to community-based organizations like us on the call, so that we're able to sustain and carry our work and continue to build capacity and funding for organizations to do this work moving forward. So yeah, those are the top three, I would say, things that OHC.
Just three.
And then other stuff on the side.
Of course. Well, and thank you for highlighting and uplifting mental health. It is so stigmatized in our community. So much work to do there. So thank you to your organization. Izzy, what are your plans? What are you working on for 2022?
You know, it's like, I think I was explaining this to somebody yesterday. It sort of kind of feels like a roller coaster ride, in the sense that 22 is thrilling and exciting, and I really want to get on it, but like I'm also really scared and not really sure what's going to happen at the same time. So there's all these things that we want to focus on, we want to do, that we want to make sure happen. One of the main things that, or a couple of the main things that we really want to focus on, is really the devastating health impacts of climate change, and making sure that we build community resilience around this, whether that be around forest fires and smoke inhalation, whether that's exposure to some of this extreme heat that we've been having, or being able to withstand a winter storm, which we're going to be having more extreme and more often. And primarily, a lot of our communities are unprepared to be able to bounce back from their house burning down, or not being able to cool down or cool off during some of these extreme heats and causing some death in our community. So we really want to make sure that in 2022 we really start having a stronger focus on a lot of those health impacts that climate change is really bringing to our community. And then over the COVID-19, we've seen the community health worker really grow into a big and huge part or cog of the healthcare delivery system that we have here. And so we've been working with community health workers for the last 2 decades, 20 years here at Familias. We've had a lot of pilots with health systems and partners where we've really tried to figure out the role and the value that community health workers have in our community and health equity. And so really making sure that CHW services and workforce development are a big part of what Familias en Acción does in 2022. I know that we currently have a partnership with both Centro and Adelante Mujeres to continue developing a culturally specific CHW certification curriculum that we want to make sure that we continue to develop this workforce and really build and give them the skills that are needed to confront a lot of what they're doing in the community already, right? And also, I think that we need to look inward a little bit. I think I'm tired. I know my team is tired. The mental health and the devastation that we're all talking about also impact us and impact our staff. And so really figuring out how as an organization we can increase mindfulness and self-care through internal policies and commitments to folks who are on the front lines, So I think those are also really important, I think focusing on our staff and on our teams, making sure that, again, self-care and mindfulness are part of the work that we're asking them to do.
It's so nice to hear an executive director talk about self-care. Thank you, Izzy. Everyone's hurting right now. And then so much has been asked of our nonprofits and our nonprofits that are on the line. And so hearing an executive director speak to mindfulness and self-care is just really wonderful. Vanessa, anything you'd like to add around 2022 plans and goals?
I believe that I would just echo some of the stuff that Olivia and Izzy have touched on regarding mental health. That has literally become a shortcoming within our services and being able to sustain them from the client standpoint, from our community standpoint. You can't, codependency and mental illness and post-traumatic stress disorder, all of these run rampant, especially within our population that we serve, especially generationally with children that are growing up across the borders without their parents. So we're hoping that that will be part of our initiative moving forward within the state and creating new proposals for grants moving forward. Then we also have initiative with also CHWs, recognizing the hardship that comes with that. Not to mention they are the key navigators that bridge that gap between health disparities, health services, health service delivery, our client, and of course the state. And that within itself, we're looking into Washington County health education and inclusivity through our CHWs. I'm hoping to start different kinds of education initiatives within our population, within our community here in Cornelius and Hillsborough, Beaverton, to talk about those chronic illnesses that do affect them, because within our culture, we see a lot of folks that don't want to ask for help, that they do have distress and they don't do the preventative assessments that happens. And within that, that makes sense, but I'm hoping to educate, and within that we will hold power, know when to ask for help so we don't have that severity of chronic illnesses and infections specific to COVID-19.
Thank you. And I didn't know much about the CHW work that y'all are doing. So that's really exciting. Thank you. My goodness. We have time for one question from the audience, and I'm just going to take the first one that popped up. Ricardo, thanks for being here and thanks for answering a question. Nice to see you. I'll just go ahead and read his question. What suggestions have you got so we can overcome the inherent trust we have in our community rather than experts, as it refers to some hesitancy to the benefits of the vaccine, given that La Comadre has told them about how bad it is. This is a vaccine question. How do we utilize our trust, knowing that the folks that we serve are hearing from other leaders as well. I'm gonna say, Izzy looks like he's thinking. Olivia, you want to, Vanessa? Yeah, go ahead.
I would say mentorship, people who are telling stories to counteract Abuelita's bad experience. That's like the best ways, storytelling and sharing. And also it's culturalistic. Why not feed into that and use that as an opportunity? We should be using voices within our community of how it was successful to help with that hesitancy. That includes religious leaders. That includes, you know, any kind of leader within our community, the store leader, what have you. Those really important mascots and voices that we have here at our fingertips to share those stories to help with hesitancy of vaccinations.
That almost touches upon some of the narrative work y'all are doing that I know Itzel and Juan Carlos and other wonderful staffer at Centro are doing as part of the Northwest Health Foundation. Little shout out to my org. Izzy, you want to answer, provide some thoughts?
Yeah, and that's probably all they are. It's just some thoughts, you know, over the pandemic, vaccine hesitancy was a topic in many of the conversations that we were in, right? And a lot of what the health systems, health authorities, local, state health authorities were asking us is like, how can we address, you know, vaccine hesitancy? How can we get the community to really trust, right? And I think a lot of the times they were asking of like, what are the things that we can do to make sure that community really sort of kind of trusts us? I guess what I'm trying to say is they saw that, or we see vaccine hesitancy as a community problem versus a system problem, right? It's like, what are we doing that the community does not trust us? Why are they believing what their neighbor, what their so-and-so is telling versus what we're doing? And a lot of the times, a lot of the questions were like, how can we go over there and tell them what they're thinking is wrong? And really sort of kind of address the issue in the community, as opposed to what are we not doing, or what can we do to make sure that we are building or increasing that trust, so that pandemic, you know, 2022 or something, we have built that trust. Community are looking at us as a trustful group or agency that has our best interest in mind. Currently, that is not the rhetoric or the sort of kind of the narrative. You know, we don't think that health systems or agencies, institutions have our community's best interest. And again, the proof is in the pudding. We see that in the rates of infection. We see that in the inequities that exist. We are not a priority in anybody's agenda. And I think that maybe what we need to do is focus internally a little bit and not really see vaccine hesitancy as a community issue, but rather as an institutional one.
If you could see me, I just want to like jump out of my chair or jump at my desk. I thank you, Izzy, for highlighting that, because I think, you know, we have so many folks from various agencies here today, and this isn't simple, right? And we don't have simple answers for a very complex problem, and there's no checklist. It's not enough to have a bilingual staffer. You have to do that internal work and reflect on a system that has been problematic. Olivia, anything you'd like to add?
No, I think my colleagues answered it all. So I don't know if we have time for another question, but yeah, I'll turn it over to you.
Well, thank you so much to all three of you for your thoughtfulness and your leadership in the community, and for being a part of this panel today. And I'm going to hand it back to Centro staff.
Hey, hello. We're coming back. So just thank you so much, all of you, for joining us today in the panel. There's a lot of ways that each of us can be champions of health equity that were highlighted today. You know, learning to be a part of this process, these systemic changes that can happen to make it easier for us to be a part of this process. You know, just the many ways that we make decisions in the community. So I appreciate every single one of you being here. And today we kind of invite you all to continue thinking about the ways or circles of influence and the different positions that we have. And I want to also, have everyone consider what position, if you are in a position to donate, and if you feel so inclined to give to the economic and the health initiatives that are happening that are really important in this room. So thank you so much for, I'll drop the link in the chat again, and I'll send out the recording of this panel to everybody who signed up for the links. And just in case you missed the first part of it, I'll send it to you. And then also we'll put it on our Facebook. So, as we're rebuilding this next year, our economic and our health systems from the pandemic, we really don't want to go back to, what we previously experienced. We really want to be a part of this process. We really want to move forward with, I heard something today that felt like, to me, the word humanizing, humanizing our processes so that we're able to trust our health institutions. And holding equity, as we continue at the core of everything that we do, racial equity that was mentioned, health equity, economic justice that was mentioned as well. And so just thank you all for joining us today. And we really hope you enjoyed the health equity panel this noon hour. Thank you.